862-1065. And we will be speaking to Blum Khan from Marie Stopes, and he's just going to be speaking to us a little bit more about abortions, or rather taking the safe route to getting an abortion. So in developing countries, more than 22,000 women die from complications from unsafe abortions each year, and 6.9 million are treated for complications. So in an effort to reduce abortion-related deaths, South Africa legalized abortion in 1996 through the Choice in Termination of Pregnancy Act, which gives women, regardless of your age or marital status, the right to access to abortion services within the first 12 weeks of pregnancy. The Act can also extend access to 20 weeks of pregnancy in specific cases. And here to talk to us a little bit more is the country's largest non-profit provider of sexual and reproductive health care services, known as Marie Stopes South Africa, and they seek to impact the quality of life in South Africa by decreasing marital and infant mortality, averting unsafe illegal abortions, decreasing the number of unwanted pregnancies through contraceptive uptake, reducing the impact of HIV, STDs, and cervical cancer, and expanding their services wherever possible. So good afternoon, Blum. How are you today?
Good afternoon. I'm good. Thank you very much. And thank you for allowing me the opportunity to be on your show. I really appreciate it.
And it's only a pleasure to be speaking to you and to create awareness around the unsafe route of abortions. So although abortions are legal in South Africa, but yet there are so many illegal abortions still taking place. Like, what would you say are the main causes for that still taking place?
I think the main reason is stigmatization. I think women, it's a very sensitive situation that they face, and it creates huge anxiety for them. And I don't think there are sufficient services available where women can be treated confidentially and have the confidence, that when they seek the service, that they will be treated with dignity and they won't be judged. And that kind of leads, because of all that stigmatization, and it leads to a situation where women then default and they try and seek these services from illegal providers, which we call street vendors, and these are typically people with no medical qualifications, and all they do is they take money from women in exchange for medication, which in many cases the quality of the medication is untested. You don't know where they're getting this medication from, and in many cases we find they are just being scammed. And we see many women come back to our clinics where the termination of abortion is incomplete, and we then have to assist with completing the service for them. So I think the other thing is there's a lot of conscientious objectors in the medical service provision area and in the public hospitals. So there are people who will not or refuse to provide the service for whatever reasons. It's either cultural reasons or religious reasons, and that drives women to illegal services as well.
And I hear clearly what you're saying, but then again, if you are a medical profession here in South Africa or globally, you basically sign an act that states that you won't do any harm, which means that you can't deny someone if they do come to the hospital and they want an abortion.
You're absolutely right. And under the Hippocratic Oath, which all the doctors and medical professionals sign on to, it says that if you are unwilling to do the service, you must take the next step and refer the person to a place where they can get the service in a safe way. But this judgment process where people just close down their shutters and decide, I'm not going to be of assistance, is completely unacceptable. And you're absolutely right. I mean, it's a breakdown in the medical profession in terms of a caring and safe service that they've signed on to provide. And so you're absolutely right. There's no reason why they should be doing it. And we are trying to push back. Government has up to now put through guidelines in terms of the process to follow in the event of conscientious objection, but they don't enforce it. So there's all these great policies and great laws we have, and there's a dire shortage of good enforcement in the country, which unfortunately is experienced with people seeking abortion services as well.
100%. And then there's also the Choice in Termination of Pregnancy Act, which I stated in the beginning, that allows a female to have an abortion within the 12 first weeks of pregnancy. But why is that the case, that you can only have that abortion within that period?
Okay, so there's a whole lot of rules in place around abortions, right? And in South Africa, the maximum time at which you can have an abortion, unless there are exceptional circumstances, is up to 20 weeks of pregnancy. So in the first 9 weeks of pregnancy, it can be done through a procedure called a medical abortion, which is typically a consultation with a professional nurse, a ultrasound to determine the gestation, and then a medication process. If you're beyond 9 weeks, between 9 and 12 weeks, in South Africa, nurses can provide the service as long as they have the right qualification. And after 12 weeks, it must be done by a medical doctor. So it's very regulated. And I think you want to be sure that you take the client through a proper process where they understand what the procedure is all about, and to make sure that they're making the right decision. So you want to guide them through that process, and ultimately you want to leave the choice to the woman. It's her body, it's her right to choose, and whatever choice she makes after you take her through the consultation process is a choice you must respect as a medical provider. And all these guidelines are set in terms of the latest time in which you can do an abortion service by the World Health Organization. So this is internationally guided through proper processes, and research that has been done on it. And we follow that at Marie Stopes. We comply with the law, which, as you said, is the CTOP law, and we ensure that we do the ultrasound, we do the consultation, we provide the right level of information and awareness, and we do the procedures in a safe and confidential setting. So that's the approach we follow.
And you are still tuned into Sakisi's We're Building the Nation Podinasi. We are speaking to Blum Khan, the country director at Marie Stopes South Africa. So if there's any questions you have around abortion, do send it through on 061-862-1065. Blum, you've also mentioned that if it's 9 weeks, then a medical nurse can do it. But once it's reached after that point, then it requires a doctor. Is it because there is more risk involved that it requires a doctor? What is the reason that the doctor comes in after the 9 weeks?
Yeah. So after 9 weeks, you can do it with pills, abortion pills, medication. Between 9 and 12, a nurse can still do it. So nurses can do it up to 12 weeks. Beyond 12 weeks, it must be a doctor. And yes, the potential for many more complications. And so the law wants to be clear that the right qualified person is involved in the procedure. It is about complications, and it is about making sure that the right decisions are made in the event that there's a complication. And that's guided by a medical doctor who has been trained to provide an abortion service up to 20 weeks. So doctors can do it from anywhere, from day 1 to 20 weeks. Nurses can only do it up to 12 weeks. And the longer you go through the pregnancy, the more potential there is for complications to set in. And that's why you need a doctor to do the service after 12 weeks.
Excellent stuff. And then, as you've mentioned earlier, that it's the woman's choice, and we all know in life we all have choices that we can basically take, and we have a constitution that protects us in most cases when it comes to decision making. So is it important to ask so therefore it is basically important to ask whose choice it is at the end when it comes to abortion? Does it depend on the man? If you are married, for instance, that determines if you need to take an abortion, or is it the person who is pregnant?
Okay, we leave the choice to the woman. Okay, as I said, it's her body and it's her choice. What we do is, where the couple wants to go through the consultation together and have the discussion, that's permitted. But we also realize that sometimes women turn up at our clinics, and women face many, many challenges, including gender-based violence and all kinds of other issues. And so our rules are quite clear. Once the woman has come into the setting, the question is, do you want to be here on your own? If the answer is yes, then we respect that choice. If she says, oh, I'd like my partner to be in the conversation, we would allow that. But we want to be sure that nobody is coerced or pressurized into any decision. It must be the choice of the woman, who then has to go through the procedure and say, yes, I'm going to go through with it, or no, I'm not ready to go through with it. And we don't want anybody to interfere or put any pressure on that woman towards that decision.
Blum, so just a few WhatsApp questions. Does abortion have an impact on a woman's body, or if it's done multiple times?
We discourage multiple abortions. What we do is we say, listen, if you end up with a oopsie, and you need an abortion, let's actually make the right decision and go through with it, and thereafter follow a family planning process, Try and follow a process that mitigates unwanted pregnancies. That really is the process we want to follow. We do a very detailed consultation, and it includes things such as, in the past, have you had a cesarean section, and how many times have you had an abortion, and if you continue this. But what we do not want to see is abortion becoming the default for contraception. I mean, contraceptive methods is something you should follow, and you shouldn't be relying on abortions to achieve that. That's something we would definitely not support.
Definitely. And then another one is, what are the different types of procedures when it comes to abortion? You've touched on that already, where you've mentioned about the pill, and then you also spoke about the surgery.
Yes, correct. So when you say surgical, it's not really. The first one is medical. It's pills, okay, up to 9 weeks, and then after that, it's called a vacuum aspiration service for between 9 and 12, and after 12, the doctor gets involved, and it's a more. You can argue that it's a bit more of an invasive procedure, yeah, but that's why we also need the doctors there.
Okay, and then the next one asks, how far along the pregnancy should be for a woman to decide if they want to have an abortion?
Okay, so women go through their menstrual cycle, and when they miss a period, it's always a good, and they've decided this is not a pregnancy that was planned. They want to. This is kind of a pregnancy that they kind of weren't expecting. They should then come along and assess whether they are pregnant for a start. And if they are pregnant, typically the indicators are about 4 to 6 weeks your period to be in there. And ideally, we would recommend that you come in for the service earlier rather than later, because the longer you leave it, the more expensive it becomes, as you can imagine. If a nurse can do it up to 12 weeks, the cost will be much lower. If you then have to bring in a doctor, you're now starting to pay doctor rates, which is a lot more expensive.
And
so I ideally make the decision sooner rather than later, and don't leave it too late. Yeah.
And just to go a little bit back based on that one, in the beginning you spoke about when you do have the stigma that is attached, and what could be the reasons why so many people do go the illegal route. Do you think it's also because of the fee that's involved?
That's a very good question. And sometimes you gotta work out what it is that you're paying for. In the case of an illegal or an unlicensed illegal service, all you're doing is getting pills on the street. No guarantees, okay? So what we've done is we tried for many years to work out what is it that drives a woman, besides stigma, it is cost. What is it that drives a woman to go and seek a service from a street vendor, somebody they don't even know, from one of these lamppost posters you get with numbers on them. You don't even know whether the person's a qualified doctor or nurse or etc. So what we've now done is we've decided that we will give the abortion pills to you for free. But to qualify for that, you have to come and do a consultation with a nurse. We have to do the ultrasound, and included in that, we will give you aftercare services for free. And if the termination of the pregnancy fails, which sometimes happens when you do abortions with pills, we will do the completion of the service at no cost to you. And we're doing all that at more or less the same price that you pay when you are buying pills from an illegal provider on the street, a person you don't even know, and you don't even know the quality of the medication. We are part of an international organization, and we are obliged to follow the international medical protocols. So that's all part of a service that you're getting, including, like I said, free aftercare, and we will complete the service for you. It's a guaranteed service. It's not kind of here's your pills and then I disappear kind of model, which I think is a very high risk model and creates huge potential for safety for women. Yeah.
Definitely, because I wanted to say now that you've mentioned it, it's not guaranteed that the pill is going to work. So that is why it is important to go to healthcare or a hospital that's able to assist you further if there's any complications, because I'm also learning a lot now because, like you've mentioned, it's not guaranteed that that pill basically works, and that is why it is recommended that you do go to a hospital.
Absolutely. I mean, the last thing you want is to part with your money for medication that you don't even know the quality of, and and it's not guaranteed. I mean, this is a service you want to be satisfied that when you go through the procedure, that is going to give you the end result you're looking for. And that's the guarantee we give you at Marie Stopes now.
And then another question, when a teenager falls pregnant and they would like to have an abortion at Marie Stopes, do they have to bring an adult, especially if they are hiding the pregnancy?
No, we don't ask any questions, and they're allowed to seek services from us without bringing an adult. If they do want to bring an adult, that's fine. We will deal with we will kind of accommodate the adult in that discussion. But ultimately, the decision is the woman. It's a very personal decision. It's the woman's decision who wants the procedure.
And then we spoke about the Choice in Termination of Pregnancy Act, and the reason why this act was implemented was because it represents the recognition of reproductive rights for women. So why does women not have the right to decide when they want sterilization? Is there a specific reason why in today's world they basically leave it up for the husband to make the choice if you are not going to have further children, or when you do go to a hospital and you say, but I don't want any more kids, can you sterilize me? And then the doctors will basically look at your age and so forth. Is there a specific reason for that?
No, I think we're still facing a equality problem, where women are not yet equal in our society, and we need to work on that very fast to get them to an equal situation. I think it's still a male-dominated society, and so that comes through in some of those decisions and some of the policies that we still see coming through through government. And listen, if you look at this, you say, why aren't men going for their vasectomies? I mean, they have a role to play in this, and they should be put to. That should be put to them. Why aren't you doing this? Why are you putting all this pressure on the women? And why aren't we balancing this up, to say, listen, we want to have a planned family situation, and at some point in time we're going to decide we do not want to have any more children. One of the options is that there's sterilization, but another option is the men go for vasectomies. I mean, there's very many options, and I think that balanced approach is not in our system yet. And we need to get there.
And we are actually running out of time, so just two more questions. Do you as Marie Stopes provide counseling before and after you've made your choice? Because it can have a psychological impact on the individual.
Absolutely. And up to now, we do provide the pre-abortion counseling, and we're building more capacity now to provide post-abortion counseling. But you're absolutely right. I mean, this is a very a major decision a woman makes, and it does have sort of ongoing trauma and ongoing psychological issues, and we need psychosocial support. And so we are doing it, and we are trying to build more and more capacity as we go through this process.
Plum, and just before I let you go, like, how long must you wait after an abortion if you want to have intercourse again?
Normally the nurse it depends on a sort of different situations, but in the consultation, the nurse will actually guide you. They will say to you at this point in time, give yourself a chance to recover to this point, and then thereafter you can go back to kind of a normal kind of sexually active life. But it's very hard to say that there's a line you draw. It really is a consultation process, and you take the guidance from the consulting nurse or doctor, and they will guide you. And remember, we give you aftercare. So if there's any situation that you face after you've gone through the procedure, you call the contact center, and they will put you to the aftercare services nurse and will guide you.
And earlier, sorry to interrupt you, and also earlier by one of the questions that was asked, like, can you have multiple abortions? You've mentioned the contraception. So when is the right time to go on contraceptives and have that conversation with your child? Because a lot of children are afraid to tell the parents, like, I want to go on contraceptive or so forth.
Yeah, as early as possible. It should be made part of normal discussion, with moms and their daughters. It's obviously more difficult for dads and their daughters sometimes. But in the family, it should be a normal kind of process of a discussion, and women go through what I call a hormonal change cycle, They go from young girls into puberty, into their adolescence, into sexually active, and then they go into productive cycles, and then obviously they go into premenopause and menopause. And all that, in my mind, we should be clearly setting a policy for in our healthcare system. We should not have this transactional healthcare system, that says, okay, now this is what you do. It should be, hey, here's your hormonal change plan for your life as a woman. And that would help. That would be very helpful, because that opens the discussions in a much easier way. You say, hey, when you hit your puberty, these are the things that are going to happen. Your body will change in this way. And by the way, if you become sexually active, your chances of pregnancy are very high. And if you are going to become sexually active, you should consider contraceptives. Now go for a consultation and determine what is the best contraceptive method for you. Because contraceptive methods are also different. Yeah,
definitely. So, Plum, just those questions that I wasn't able to ask. If anyone have further want to know more about abortions or have any questions about reproductive and so forth, how do they make contact with you?
They can talk to us at info@MS Health, or they can come to our contact center, which is it's a toll-free number, 0800 1175, I forgot the number.
Okay, so
anyway,
it's
you go onto our website.
11 7785.
That's correct. Okay, so they can just come in and ask the questions, or they can post it on, if they go onto our website, there's a WhatsApp line. Post the questions to us on WhatsApp, and we will formally respond to you.
Okay, excellent stuff. Any last words?
No, we look forward to seeing many, many women to provide services to. And please don't take the unsafe route and go to the street vendors. We've seen some shocking results of that. So please understand that Marie Stopes will give you a confidential, private, and safe service. And if we can't do it, we will refer you to the right people who can do it in a safe way.
Thank you very much, Plum, for taking the time to speak to us today. Have a marvelous day further.
Thank you to you as well, and thank you to all your listeners for the interest. We really appreciate it. Thank you.
It's only a pleasure. Bye.
Bye.
And that was Blum Khan, the director at Marie Stopes, and he was just speaking to us a little bit more about abortion. So at Marie Stopes South Africa, pro-choice refers not only to reproductive freedom and the right to a safe abortion, but also the choice of when and with whom to have sex, regardless of sexual orientation. So do go check out their website, www.mariestopes.org.za, or call them on 0800 11 7785, or their WhatsApp line you can also use, or the best way to go is Facebook or Instagram, and it's just simply mariestopes.org.za for Facebook and mariestopes_SA on Insta. And right now we'll go into the news at 1 o'clock with Alungile. So keep it locked to Bush Radio 89.5 FM.